This is a video lecture on the topic of ethyl alcohol or ethanol. This is what we refer to as alcohol in the adult beverages we like, such as beer, wine, and hard liquor. In this lecture, we're going to be talking about the nature of ethanol. We'll talk about its metabolism, the acute and chronic negative health effects, and we'll finish with some of the beneficial aspects of ethanol. So what is ethyl alcohol? Chemically, it's not classified as a carbohydrate or a lipid. It is classified as an alcohol. And here you see the molecule of ethanol, and you can see the hydroxyl group that makes it an alcohol. It has a similar metabolism to fatty acids. It is not a nutrient in that it doesn't really provide any significant metabolic benefit, and by excluding it, you don't experience any deficiency symptoms. But it does supply calories and energy in the form of 7 calories per gram. It's metabolized in the liver, and it's metabolized to acetaldehyde and then to acetate. There are 3 oxidizing systems for ethanol: the alcohol dehydrogenase system, the microsomal ethanol oxidizing system, and the catalase system. We'll proceed to talk about all of them. So first, let's talk about the alcohol dehydrogenase pathway. The alcohol dehydrogenase pathway converts ethanol to acetaldehyde. It occurs in the cytoplasm of liver cells that more technically are known as hepatocytes. Something significant to note is that in this enzymatic reaction, NAD+ is converted to NADH. That'll become an important factor in our discussion later. Then acetaldehyde dehydrogenase converts acetaldehyde to acetate. In this case, acetaldehyde enters the mitochondria of the hepatocytes, and there the enzyme converts acetaldehyde to acetate. And again, we need to note that in this case, an NAD+ is used up to form NADH. This acetate that's produced can then leave the hepatocytes or stay there and actually be converted to acetyl-CoA and used in the TCA cycle to produce ATP. The NADH that's generated can contribute its electrons to the electron transport chain and therefore lead to the production of ATP by oxidative phosphorylation. The alcohol dehydrogenase pathway oxidizes 80% of the ethanol that humans consume. However, the alcohol dehydrogenase pathway has a limited rate of activity. When we drink alcoholic beverages and our ethanol level moves to above 20 milligrams per deciliter, the alcohol cannot be completely oxidized by ADH. The ADH pathway can only handle ethanol at a particular rate. So if you drink more alcohol and you elevate your ethanol level above 20 milligrams per deciliter in your blood, then you begin having these substantial effects of ethanol on the systems of the human body. Toxic blood levels of alcohol are greater than 80 milligrams per deciliter. At 100 milligrams per deciliter, that's equivalent to a 0.10 blood alcohol percentage. And so when you're trying to equate the amount of ethanol in the blood with a blood alcohol percentage, this kind of gives you the equivalency. If your blood level of ethanol is greater than 300 to 400 milligrams per deciliter, then you could die. Binge drinking is defined as reaching a blood alcohol percentage of 0.08 intermittently, meaning that, on different days, you drink enough alcohol to get that level of blood alcohol. In males, this equates to greater than or equal to 5 drinks in 2 hours, For females, it's greater than or equal to 4 drinks in 2 hours. This table kind of defines what is a drink. You can see that a 12-ounce beer is considered a drink, 5 ounces of wine a drink, and 1.5 ounces of hard liquor is considered to be a drink. So when we get back to this idea of 5 drinks or 4 drinks in 2 hours, you can see what we mean by a drink. The problem is that when you consume excess alcohol and the ADH pathway cannot handle it all, you get biochemically the depletion of NAD+, which impairs the TCA cycle, gluconeogenesis, and fatty acid oxidation. We'll talk later about this in greater detail. Now, once the alcohol dehydrogenase pathway has been exhausted, then excess alcohol can be metabolized by the microsomal ethanol oxidizing system, or MEOS. The MEOS can oxidize other substances besides ethanol. That's why if one is routinely consuming ethanol and occupying the MEOS system, then drugs can rise to higher levels and you can have more side effects, and toxic substances are not detoxified and they can have toxic effects. This system consists of mixed function oxidase enzymes, in other words, the cytochrome P450 family of enzymes. And the key enzyme for metabolizing ethanol is CYP2E1. The MEOS occurs in the smooth endoplasmic reticulum of the hepatocyte. It leads to the formation of acetaldehyde, NADPH is expended, and when in the metabolism of ethanol, this represents the metabolic pathway where 20% of the ethanol will be metabolized. In the consumption of alcohol, we've all heard that when somebody drinks alcohol on a regular basis, they develop something called tolerance. How does that tolerance develop? Well, when one drinks alcohol on a regular basis, what happens is the body adapts and the cells adapt by producing more enzyme. That we use the term, the enzymes are inducible. That means that with regular alcohol use, the enzymes are produced in greater quantity, and so the MEOS can handle more ethanol. So the person that develops tolerance can drink alcohol and not get drunk as quickly as somebody who doesn't use alcohol on a regular basis. The catalase system is present in peroxisomes of cells. It can convert ethanol to acetaldehyde, but in the liver it plays a minor role. It plays a much more substantial role in tissues and cells where there's no ADH, like the brain and nervous system. So when ethanol reaches the brain and nervous system, the catalase system can take some of that ethanol and get rid of it. Note that for all 3 of these pathways, the acetaldehyde eventually is going to be converted to acetate in mitochondria. This diagram illustrates these pathways. You can see the 3 pathways, the ADH, the MEOS, and the catalase pathways. Again, you'll notice that NAD+ is expended in the ADH pathway, as well as in the pathway of converting acetaldehyde to acetate. You can see that all these pathways lead to the production of acetaldehyde. The acetaldehyde then enters the mitochondria inside whatever cell is there, whether it's a liver cell or it's a brain cell. And then acetaldehyde dehydrogenase can convert it to acetate. Again, you see an NAD+ being used up in this process. And later that will become a big issue, the accumulation of NADH and the absence or deficiency of NAD+ due to the metabolism of ethanol. So we said that these pathways have a rate of activity that can get rid of the ethanol. But when you drink ethanol in amounts that go above the capacity to metabolize it, then it begins to have effects on various tissues of the body. Whether it's the brain and developing slurred speech, drowsiness, headaches, and then you've got things like impaired judgment and decreased perception and coordination, even to the point of unconsciousness and coma. And also with tremendously high amounts of ethanol consumption, people can even develop blackouts where the brain is affected such that you wake up somewhere and you don't even know how you got there. You lose time. So it can affect the brain. It can affect the digestive tract with vomiting and diarrhea, upset stomach. It can affect the respiratory system with promoting breathing difficulties. It can affect senses like distorting the vision and the hearing of the person. And it even can affect your red blood cells, where it can actually cause the destruction and loss of red blood cells so that you don't have the oxygen carrying capacity that you need in your blood. But the bottom line is, this tells you why people shouldn't be making any big decisions or doing anything that requires skill under the influence of alcohol. Because when you are affected by ethanol and you can't metabolize all of it, the impaired judgment may lead you to do things that you would have never done with a rational mind. We say to people, don't drink and drive, but by the time you've been drinking and you're intoxicated, you're really not in a very good position to make a decision about whether to drive or not. So you can see all of the things that happen when you drink alcohol to levels that this metabolizing system can't handle. And you can see again how this could lead you to trouble in the immediate moment after having been drinking. Then we've got the chronic effects of ethanol, meaning over time, when people are using large quantities of ethanol regularly, what kinds of things can happen? Well, we've got both unintentional and intentional injuries. When you are consuming ethanol regularly and you're impaired, you can have all sorts of accidents, whether it's crashing your car, hurting another person, falling down, dropping a cigarette and catching a house on fire, diving into a pool and drowning. There are a lot of injuries that can happen that will affect a person for the rest of their lives. And then, with our judgment affected, you can end up picking up a gun and shooting somebody. We know a lot of sexual assaults occur under the influence of alcohol, as well as domestic violence. And of course, this not only leads to physical injury that's long-lasting, but also legal problems and then subsequently financial problems related to it. And we know that when you drink a lot and you get pulled over in your car and you get a DWI, that this goes on your record, can affect your employment, your ability to get a dietetic internship or get into graduate school. We know that it can affect your performance on the job if you are intoxicated while working. And of course, the whole relational difficulties that come with having to deal with an unreasonable, intoxicated person. And we've heard of cases where people drink so much, they have alcohol poisoning, and then they get some form of permanent brain damage. But we know with chronic diseases, ethanol can contribute to that. All the cardiovascular diseases, liver diseases, and we'll talk about that in a little while. Brain and nerve damage, sexual problems. One thing that when someone who's intoxicated goes into an emergency room, it's a mandatory procedure to give them a big thiamine injection because it's notorious for people who are alcoholics to be thiamine deficient due to the fact that alcohol promotes the destruction of thiamine and poor absorption of it. So a lot of times when you see a person that uses alcohol a lot appear disoriented and intoxicated, it's actually because they're having brain problems and nervous system problems from having a thiamine deficiency. Also, drinking alcohol inflames the lining of the stomach, so you get stomach pains and inflammation, and if the drinking goes on and the inflammation continues, one can actually have perforations in the lining of the stomach and the small intestine and develop ulcers. People who use alcohol regularly in large quantities are notorious for being malnourished due to the fact that the empty calories provided by the alcohol suppresses the appetite and the person just doesn't eat. And second, when they do eat, the alcohol can actually block their absorption of nutrients. Chronic alcohol use can lead to cancers of the mouth, throat, and digestive tract. Chronic use of alcohol can cause the pancreas to inflame, affecting all of the functions there, including the release of insulin, the release of glucagon, as well as the release of digestive enzymes. And finally, lactic acidemia, which we'll talk about in a little while. This slide is sort of a summary of all the organs and organ systems that can be affected by chronic alcohol use. So now we want to talk about etiologic factors, and it's important you know what the term etiology means. Etiology means causative factors. So etiologic factors related to alcohol or ethanol would be aspects of ethanol use that actually cause the physical difficulties, psychological difficulties, and the problems in the body. So what causes the toxic effects of ethanol? Well, first, acetaldehyde by itself is a toxic substance. It can impair protein function. It can cause the death of cells. You can imagine there can be death of liver cells due to acetaldehyde buildup. And if you're consuming a lot of ethanol, and that ethanol is being metabolized by the ADH system, and the rate of acetaldehyde dehydrogenase isn't fast enough to handle all the acetaldehyde generated, you can get a buildup of acetaldehyde, and it can substantially damage the liver cells. It attaches to proteins. It prevents them from doing the things they need to do, for instance, like cross-linking and forming microtubules that would be the infrastructure of liver cells. So when we think about the death of liver cells and damage to the liver, acetaldehyde is a main player. Earlier, I spoke of NAD plus and NADH, and we saw with the ADH system and the activity of acetaldehyde dehydrogenase, in the processing of large amounts of ethanol, NAD plus gets used up and NADH accumulates, causing a rise in the NADH-NAD plus ratio. So we know that the tricarboxylic acid cycle really requires lots of NAD to be able to continue forward. Well, when there's not a lot of NAD plus, there is a shift from the TCA cycle having acetyl-CoA go into it to acetyl-CoA being directed towards fatty acid synthesis, the making of a lot of fatty acids. And so when you think about the concept of your liver becoming fatty and accumulating large amounts of fatty acids and fat, this is how ethanol causes it to happen. With the lack of NAD+, you get more fatty acid synthesis than you normally would and the accumulation of fat. And this between this and the damage to liver cells by acetaldehyde and the accumulation of fat, the liver begins to suffer pathology, and you're heading down the road to having liver cells die, scar tissue come in, and then the liver being misformed and its structure being altered so that it doesn't work well. Another aspect of this is large amounts of NADH promote the conversion of pyruvate to lactate. If you'll remember, lactate dehydrogenase requires NADH in order to convert pyruvate to lactate. With the large quantities of NADH around, that promotes lactate dehydrogenase, converting more pyruvate to lactate throughout the body. And so what ends up happening is this lactate accumulates, and when lactate accumulates in the blood, hydrogen ions are there too, and it causes the pH of the blood to go down and for your blood to become more acidic. And that is a really bad state. You can die from lactate acidosis. It also can impair your breathing and affect your function of your lungs. Also, this change in ratio impairs gluconeogenesis. Okay? So the idea here is that converting lactate to pyruvate requires lots of NAD+. Okay? If you'll remember that, if we're doing the reverse of converting pyruvate to lactate, which requires a lot of NADH, to convert lactate to pyruvate in gluconeogenesis, you have to have a lot of NAD+. Well, in this case, with lots of ethanol consumption, you lack the NAD+, so you can't convert lactate to pyruvate. And we said that gluconeogenesis is the use of non-carbohydrate substrates to make glucose. We know gluconeogenesis only occurs in the liver. So in the liver, what happens is lactate cannot be converted to pyruvate, and if from muscular work, lactate is coming back to the liver in the Cori cycle, all this lactate gets stuck there and it can't be used to make glucose. And so that's why a lot of people that chronically use alcohol, like alcoholics, will suffer from bouts of hypoglycemia because they cannot do gluconeogenesis effectively with lactate. Well, also, alcohol dramatically affects vitamin A metabolism. And ethanol is an inhibitor of retinol dehydrogenase. And ethanol will allosterically cause retinol dehydrogenase to not be active in converting retinol to retinal. Retinal is a very important retinoid that's important in eyesight. And so if retinol can't be converted to retinal, that causes a problem. And we should note also that retinol's converted to other things too, and ethanol inhibits that as well. So it really impairs vitamin A metabolism. Now, another thing here is that alcoholics often need a higher intake of vitamin A because ethanol promotes the direct destruction of retinol. And that causes retinol depletion. And it also ethanol promotes vitamin A to leave the liver cell where it's stored and go to the rest of the body. So the liver becomes depleted of vitamin A. So as you can see, vitamin A metabolism is significantly impaired. Now we can't leave the topic of ethanol without talking about the beneficial effects of alcohol, because there are some. All of us enjoy an adult beverage here and there, and we should. We should enjoy it and savor it in the right amounts. So epidemiologic studies generally show that with a moderate intake, there are beneficial effects for the major chronic diseases related to ethanol. But it's no more than 2 drinks per day. And as we reflected on that table in the past, 1 drink is 1.5 ounces of hard liquor, 5 ounces of wine, 12 ounces of beer. So you could have 24 ounces of beer in a day, and that would be considered moderate intake. So we can enjoy and savor our adult beverages. Now let's talk about some more beneficial effects. Ethanol has been shown to be the main substance that can elevate HDL in the blood. Now what is HDL? When we get to lipids, we'll be talking more about this, but now we need to talk about it. Lipids are carried in the blood, triglycerides and cholesterol, in little transport packets called lipoproteins. And there are lipoproteins called low-density lipoproteins, very low-density lipoproteins, high-density lipoproteins. The VLDLs or LDLs are the ones that if they're elevated, they boost your risk of cardiovascular disease. However, HDL, when it's elevated, is protective against heart disease. So you would like your HDL to be higher. And ethanol is the main thing, in addition to aerobic exercise, that can elevate HDL levels. So moderate intake can do that. On the other hand, there's another lipoprotein called lipoprotein a that has very strong pathogenic effects related to cardiovascular disease. Ethanol lowers that, which is beneficial for lowering the risk of cardiovascular disease. In terms of alcohol and dementia, this condition where one has problems with memory and has some brain dysfunction, there's a U-shaped relationship between alcohol and dementia. People that don't use alcohol at all tend to be at increased risk of dementia. Those that use very high doses of alcohol have very high risks of dementia. But in the moderate intake sweet spot, the risk of dementia goes down. So the use of a moderate amount of alcohol can reduce the risk of dementia. Finally, there are accompanying substances in fermented beverages that actually provide beneficial effects. So when you think of wine, like red wine, it just doesn't have ethanol that can provide beneficial effects, but it has phytochemicals, other substances that aren't really nutrients, but can have medicinal and health benefits. For instance, in red wine, there is a substance called resveratrol, and it's an antioxidant that's been linked to lowering the risk of heart disease and other cardiovascular diseases. Red wine also contains a phytochemical called epicatechin, which protects the liver and provides heart protection. So you can see that alcohol at moderate intakes has beneficial effects. So in summary, we've seen that we can metabolize ethanol, we can convert it to acetaldehyde and then to acetate, which occurs mostly in the liver with the ADH pathway. We saw that when we consume alcohol beyond the ability of the enzyme's rate to handle all the ethanol, the blood levels can go up. And if they go up substantially, we can have acute negative effects and we can have chronic negative effects. So the use of large quantities of alcohol on a regular basis can be very, very detrimental to one's health. And we learned, though, that if we can restrain ourselves to moderate intake and savor the beverages we consume, we can have some beneficial effects. So thank you for your patience in watching and listening to this video. And please refer to it again as you are taking tests and quizzes where this content will be covered. And have a very, very nice day or evening.